U.S. government officials have issued new long-term care guidelines for battling coronavirus. These guidelines, prioritizing infection control, inspection expectations, and potential supply chain issues, are in response to the first confirmed coronavirus deaths in the United States. At one nursing home outside of Seattle, 9 people have died, and others have gotten sick from the novel coronavirus. That's according to the Centers for Disease Control and Prevention. Randy Burry, president of the Evangelical Lutheran Good Samaritan Society, led a town hall meeting with leaders from Sanford Health and the Good Samaritan Society one day after he met with Vice President Mike Pence and long-term care industry leaders from around the nation to discuss updating protocol. According to Burry, the outbreak of coronavirus isn't currently widespread enough to create shortages for medical supplies, such as face masks and gowns. However, if a widespread outbreak occurs, long-term healthcare providers could face challenges in keeping up with demand. This would make it harder to control infections, especially around vulnerable individuals like seniors.
We have enough today, and we'll have enough going forward unless a widespread outbreak occurs. Then we're going to run out of supplies or dwindle supplies pretty rapidly. And that's when we would need some help, I think, from the federal government to help distribute supplies to the areas of need.
Burry says that inspections and surveys happen all the time at every kind of facility.
I bet on any given day we probably got a survey team in one of our facilities somewhere. And they're looking at all kinds of things, life safety issues, infection control, clinical practices.
Out of all those criteria for inspections, maintaining requirements for infection control is currently the most important, according to Burry.
The message now in this new guidance is all those other things are important, but right now the focus is going to be on infection control. So really make sure you've got that part of the requirements nailed. Make sure you're doing a great job in that area, because the surveyors are going to be mostly looking at that.
Government inspectors will be surveying areas of the nation and hospitals where the virus is prevalent. When it comes to day-to-day practices, employee and resident hygiene is critical to limiting the spread of the disease, according to Burry. He says for both residents and workers, proper hand-washing techniques and general common sense, like staying home if you feel sick, is key.
The one thing I think people need to know, this is not rocket science in any way. This is hand hygiene. Stay home. If you're feeling sick, stay home. If you have a relative in a long-term care facility, if you're feeling ill in any way, don't go visit. It's pretty basic stuff. And I suppose that's the good news. Prevention on the spread of the virus should be within our capability to control to some extent, as long as we do practice those basics.
If visitors are experiencing symptoms of any respiratory illness, not just coronavirus, they should not visit family or friends in any kind of healthcare facility.
Don't come in the first place, but if you do come, don't be offended or mad or upset if a healthcare worker says, "I'm sorry, I don't think you should visit today." Because that will be a role and responsibility of our staff too.
The Good Samaritan Society has over 270 locations across the country and over 9,000 residents, according to Burry. With a reach that far, putting these basic but critical practices in action is crucial in prevention. Thursday afternoon, he led a company-wide video call with representatives from all of their locations to talk about those basics.
It's like an athlete practicing, right? It's basic stuff, but you still practice the basic stuff. And so we're lifting up the importance of doing the basics of hand hygiene, personal hygiene in all of our facilities, and just constantly emphasizing that.
In Sioux Falls, Simon Floss, Sanford Health News.
About the crossing state lines on medical licensure issues. We all remember back to September with Hurricane Dorian when we were trying to get nurses from St.